call Dr. Tom Carey, the 2024 recipient of the ICHP Health System Pharmacist of the Year Award, to present this year's Pharmacist of the Year Award.
Thanks, Laura. Before I begin, I want to recognize all the previous winners of this award who are present here today. If you could please stand up. Great, thank you. And there's a complete list of all the past recipients on the ICHP website. It's my privilege to be able to present the 2025 Pharmacist of the Year, presented to JoAnn Stubbings.
Woo!
That's
so cute.
The individuals the individuals who nominated JoAnn said this about her. JoAnn's career has been defined by leadership, innovation, and a deep commitment to advancing health system pharmacy in Illinois and nationally. JoAnn played a central role in building one of the first health system specialty pharmacies in the country at UI Health, which started with one prescription and one employee, grew into a nationally recognized, dual-accredited, $60 million operation serving over 16 therapeutic categories. Her work opened access to limited distribution agents and payer networks, setting a precedent for other health systems. She's made lasting impressions in the education of pharmacy students and pharmacy residents. At UIC, JoAnn helped develop new PharmD concentrations and a BS in pharmaceutical sciences, mentored hundreds of students and residents, and led strategic planning and accreditation efforts. Her teaching has earned multiple awards, including AACP Innovations in Teaching Award and several Golden Apple honors. JoAnn's leadership also extends to national organizations. She chaired ASHP's section of specialty pharmacy practitioners, served as a delegate to the ASHP House of Delegates, and provided testimony to the FDA on REMS programs in health systems. Her work has redefined policy and practice standards in areas like Medicare Part D and the 340B program and specialty pharmacy reimbursement. JoAnn is a respected practitioner, educator, mentor, and healthcare advocate. Her contributions have made a direct and lasting impression and impact on pharmacy practice, public health, and the profession. She embodies the spirit of this award. Please congratulate JoAnn, ICHP's 2025 Pharmacist of the Year.
Do you want me to talk? That was amazing. Tom, thank you so much, and thank you to ICHP and the nominee and everybody who voted for me. And that was, I'm just so surprised and humbled when Chris called me a while ago at 8 in the morning, and I thought that he was calling me to discuss the 340B legislation, but he told me I got this award, and I was so surprised and humbled and honored. And so I just want to thank all of you. And Tom, it's so great to get the announcement from you, because Tom, we were kind of, when we built the specialty pharmacy, we were stuck in the corner of a pharmacy and had curtains or beads or whatever around us. And Tom came from Rockford with your colleague John to see our specialty pharmacy operation. We explained everything to him, and he gave the whole kit and caboodle to John to implement. So we had a lot of fun with Tom that day. So the funny thing is that whenever I do something or publish or speak or get an award, people now say to me, but I thought you were retired. And it is true, I did retire, but true to other colleagues like Linda at UIC, we kind of, cycle back and get rehired, which is really fun. And the interesting thing is that pharmacists really don't retire. You probably all realize that. And it's been my life for so long. I decided I wanted to go into pharmacy when I was 13, and I worked volunteer in a hospital, and then I got my first community pharmacy job when I was 15. And it really came out of the blue in my family. I was first generation college, second generation American, first person and only person in my entire extended family to go into healthcare. And so it was really a great experience, and people gave me a lot of chances along the way. I noticed when I was even 15 that there were a lot of issues and challenges to pharmacy practice. And if you were here this week and heard Mary and Thermos talk, you know that some of those challenges still exist. But when I look at all of you and I see the enthusiasm of the younger generation, I think we're in good hands to take pharmacy where we need to go. So I'd like to thank ICHP, Chris Crank, and his small but mighty staff of 6 people, and they do a great job with the organization. Thank you for welcoming me back to ICHP after my stint at ASHP, and to bring me onto the Government Affairs Committee. I do know from ASHP that we are one of the most widely recognized state affiliates, and they're very eager to partner with us as they showed this year. I also want to recognize Scott Drabant, who was the Director of Government Affairs, and he brought me back into the fold, and you've become a good friend and colleague and over the last couple of years, and he even agreed to stay on and help me out in government affairs. I'd like to thank UIC, and because in 2012, UIC gave me the opportunity to build a specialty pharmacy, and we had only a few health systems in the country had specialty pharmacies. So, and I was kind of an unlikely candidate, but I had a lot of ideas, and they thought, okay, let her do that. So the bad news is that I didn't really have the resources to start out with, but the good news is they gave me Naren Kamo, who's sitting right there. And Naren, they gave me Naren 1/2 day, 1 day a week to start the specialty pharmacy, if you can believe that. And if you know Naren, you know she can sell ice to an Eskimo. And so she took it from one prescription, one Humira prescription once a month to what it is today, and she's still there. So we were also able eventually to hire technician, Elba, don't say no to me, technician, Sertucci, and Angie, and then pharmacist Chris Shump, Vincent Jai. Have to thank Clara and Janice for supporting specialty pharmacy in La Toya, and we had Tara, I just the name Alex Sandoval. Most of them are still there. I'm the only one that retired. So the thing about the group of pharmacists and technicians that we got is they were all renegades, and they were all, the first thing that's happened is you couldn't say no to them. And that might have gotten them in a bit of trouble in their previous jobs, but in specialty pharmacy, it was the greatest skill because they had to deal with insurance companies and PBMs. And they all came from humble, diverse backgrounds, pretty much just like myself, and they were super effective at engaging with patients and engaging with providers and dealing with people at the worst time of their lives when they're in a chronic complex condition and they have to take a specialty medication. So Advice to you, you know, as I see a lot of the young students, because we had students and residents who basically built our specialty pharmacy because we didn't really have the staff allocated, we didn't have the FTEs. So we partnered with the College of Pharmacy, brought in students from the P1 year all the way up through residency, and we're able to hire many of them. Many of them work all over the country in specialty pharmacy. And Lisa Kumar just published an article in ICHP of our 10-year training effort of students and residents in the layered learning model. And we counted up that we've trained over 400 students and residents in specialty pharmacy. So they have done a great job. But my advice to you is, as you go through your career and you get these chances handed to you, and someone may tell you somewhere along the line that you're good at something, that something you're doing is particularly outstanding. And it could be a professor, it could be a boss, it could be a colleague, a mentor, but sometimes you don't even realize it. And you might not agree with it, you might not take the path that they suggest, but just kind of listen and tuck it away, because that's your superpower. And when people say, what is it that you do, what are you good at? You can pull that up, and that's something you'll have, and you probably hear it over and over again. So finally, I want to thank my family, because they support me, I think, but every time I see my kids, they ask me when I'm going to retire. So one of these days I'm going to take the hint and I will retire, but just know that I'm here, I'm listening, I'm watching, and I have your back. Thank you.